Good evening, everyone. Myself, Retractor Samriddhi Ray, and I'm currently the BOD of MSFC, that is, the Medical Students for Choice Unit of the Rotaract Club of Medicrew. And today, we are honored to conduct this one of a kind session in collaboration with SIMSOG. As we have three highly respected doctors joining us today who will be guiding us about the various OBGYN pathways in the UK. Firstly, we have Dr. Ninada Chandrashekhar, who has graduated MBBS from the AJ Medical College in the year 2022 and is currently working in emergency medicine. Additionally, she is also the newsletter lead of Surgical Society of International Doctors in the UK. And today, Dr. Ninada will be talking about PLAB pathway for OBGYN. And now, without any further ado, I would like to hand it over to Amar, who will brief you all a little about SIMSOG before we begin with the session.
Good evening, everyone. My name is Amar Khan, and I am a member of SIMSOG, Society of Indian Medical Students of Obstetrics and Gynaecology. Welcome to the first All India OBGYN Student Society, proudly established on International Women's Day 2024. At SIMSOG, we are a passionate community united by our dedication to women's health. Our mission is to create a dynamic platform for medical exchange among students and clinicians, fostering growth, learning, and collaboration. Our tagline, Building Boundaries, Building Hope, reflects our unwavering commitment for advancing women's healthcare through knowledge sharing, advocacy, and innovation. We are proud to share that we have successfully conducted impactful events recently, such as panel discussion on female genital cutting in collaboration with Equality Now, a career session on functional and aesthetic gynecology, discussions on exam prep from notes to clinics, live discussion on gender-based violence, addressing critical issues affecting women globally. We welcome all undergraduate and postgraduate medical and allied students to join us. Membership is completely free, and as a member, you'll gain access to incredible opportunities for networking, learning, and professional growth. Find the general membership link in the chat box and join us today. Let's continue to push boundaries and create a brighter future for women's healthcare together. Wishing you an enlightening session ahead. Thank you.
Ma'am, you can start with the session.
Yeah, okay. Thank you so much. Good evening, everybody. So, like she said, I'm Dr. Ninada, and I'll be talking about various the routes to UK today. I'll just present my screen. Yeah, y'all can see the screen, right? Samriddhi, can you just let me know if you can see the presentation?
Yeah, we can see it, but it's not in slideshow.
Yeah, now? Is it better now?
Yeah, but put it in slideshow, no?
Yeah, it is in slideshow. Can you still not see it in slideshow? Wait, let me just share my entire screen then. Okay. Yeah, is it fine now?
Yeah,
It's fine.
Okay, thank you. Yeah, so in this session, we'll be dealing particularly about how to enter the UK as a doctor. We'll have a second half of the session where we will be focusing mainly on the MRCOG pathway for obstetrics and gynecology in the UK. So first, I want to introduce to you all how you can get into the NHS. NHS is the National Health System, which is it is the health system practiced in the UK overall. So one thing everybody needs to practice as a doctor in the NHS or in the UK is the GMC registration. There are various pathways through which you can get this registration. The main thing that I'll be talking about today is the PLAB pathway. So this is something junior doctors mostly choose to do, as it is this is mainly for entry level at junior posts. The other one is the MRC pathway. This, depending on which specialization or which field you are interested in, you can give the membership of Royal College exams. So there is MRC surgery, MRC for physicians, and also MRC for OG. Usually there are about 3 parts for it, 2 to 3 parts. So once you have finished all the parts, then again you can avail your GMC registration. The other path is the MTI pathway, which is the Medical Training Initiative pathway. This is something more experienced people prefer to do, like more experienced doctors. It is something that the UK has started this initiative to train doctors from lower income country to ensure that there is an overall equality in medical standards. We'll just briefly look at how each one is different. So the like I said, PLAB is something that the junior doctors or entry grade doctors prefer to do. And what you will require for each of it is, for PLAB, it'll just be your primary medical qualification. So anybody with an MBBS that is accepted by the UK or the NHS or GMC can sit for the PLAB exams and finish the whole pathway. But for the MRC exam, since it is an entry at a senior level grade, you would also require a PG qualification. It could either be a PG degree in India, or it could also be the MRC exams. For MTI, however, you will require at least 3 years experience in one particular field. So this is a sponsorship program, the MTI, and they sponsor doctors with these 3 years of experience in one branch. The total time now for PLAB, given all the waiting period, the earliest you can finish is maybe say 1.5 to 2 years, 1 to 1.5 if you have planned your timeline very well. For MRC, again, to sit the part 2 of MRC, I think you'll be getting more idea on the MRC pathways later. But to sit for the MRC final exams, the practical exam, you will need some amount of practical experience. So that ideally takes about 3 to 5 years. And for MTI, again, it'll be minimum of 3 years and above. Entry level, like I said, PLAB will be for junior grade. MRC and MTI is for middle and what they call as registrar grade. Now, the finances you require, PLAB, since it's a 2-step exam, is much less expensive compared to the MRC exams. And for MTI, you don't really have to give any exams as such. But once you get into the initiative program, you will be expected to give your further exams like the MRC exams, etc. But to get into the program itself, you won't be spending a lot. Now, the recognition of PLAB exams, the PLAB exam is recognized only in the UK. However, once you have got your PLAB exam and you have worked in the UK for say 1 or 2 years, you are free to move around to say Australia, New Zealand, even Middle Eastern countries. But PLAB as an exam, once you've finished your PLAB exam, UK is the only country you can initially go to. The MRC exams, on the other hand, it is valid internationally and it is recognized throughout the world. The M-type pathway is again valid only for the UK. Centers where you can give your exams. So PLAB 1, you can give in most countries. You can give it in India. In India, we have about 5 centers. But for PLAB 2, as of now, it is only in the UK. For MRC as well, the practical exams are usually only in the UK. But I think Dr. Bhalerao and Dr. Ruchi later will give you more idea. I'm not very sure about centers overseas. The duration of your registration, if you go through the PLAB or MRC pathway, once you are registered, you have permanent registration there. At any time, you can go and choose to work in the UK. However, with the MTI pathway, it is a sponsorship program which will be sponsoring you for only 2 years. Once the 2 years have ended, you will either have to apply for further programs there, or you will have to find other jobs in the UK. But your sponsorship as such is valid only for 2 years. But PLAB and MRC registrations, once you're registered, it is you're registered for life as long as you choose to keep the registration. Moving on. 1 minute. I think there is an issue. Yeah. Yeah. So now we'll be talking about the PLAB exam. So PLAB, the whole pathway in itself has 3 exams, and the clinical attachment is optional, but it is something I would definitely recommend everybody to do. We'll discuss each of these steps step by step. The OAT or IELTS is the first exam. This is a language exam. This is the basic criteria you require to start your PLAB pathway. Before you can book your PLAB 1 exam, you need to have your IELTS or OET ready. So the first thing that any student or any doctor who is planning a UK pathway does is you will have to create a GMC online account. And once you have created an account, you will have to upload a basic language criteria. You will have to meet the criteria and apply for it. So in India, we all need an OET or an IELTS certificate. But if you're from a country where English is the first language, then you will not require. But for all Indian doctors or Indian graduates, IELTS or OET is compulsory. So the criteria to be eligible to book your PLAB exam is, if you're taking OET, you will have to get a minimum of 350 on 450 in every domain. So this, both OET and IELTS, they test you on 4 different domains. So they will be testing your listening, reading, writing, and speaking skills in English. For OET, you will have to get minimum of grade B. And for IELTS, you will have to get a minimum of 7 in each individual section and an overall of 7.5. Now, the difference between IELTS and OET is that IELTS is way cheaper. Excuse me. IELTS is cheaper compared to OET. However, it is comparatively tougher than OET. But the validity of IELTS is 2 years, and for OET it is 3 years. To give a brief idea, I think IELTS at this time it costs around 17,000, and OET costs somewhere around 35 to 40,000. I'm not very sure about the OET exams and how it is conducted, but because I gave IELTS, so IELTS is around 17.5K now. Next, once you have availed your IELTS or OET certificates, you will have to update it to the GMC online portal. And as and when the PLAB 1 dates are available, you can book your slots. So for PLAB 1, it is an MCQ exam. You will have 180 minutes and 180 questions. I think you have 5 options for each question. The thing about this exam is, the exam as such is not difficult at all. It's not very difficult, the exam. But what we need to keep in mind is time is your biggest factor here, because the questions are, most of them are clinical questions. So you can expect really lengthy questions or picture based questions. They're all clinical questions. You don't have memory oriented or recall based questions or one liners like we have in our NEET exams. They're all lengthy clinical based questions. So time will be of the essence. This is a pass or fail examination. You don't have to get like really good marks. You just have to make the cutoff. So I think usually the cutoff is somewhere around 120 out of 180. And it's lesser than 120. I think the highest till now has been around 125. So you don't have to score really well. You just have to score the cutoff mark. Once you finish your PLAB 1, nobody is going to check your PLAB 1 score. And once you finish your PLAB 2, nobody is going to check your scores or give you jobs based on that. So it's just a pass or fail exam, and your marks won't matter as long as you've made it to the cutoff. And for all of these exams, for all the UK exams, there is no fixed passing mark. Like there's no, say, 50%, or there's no 120 out of 180 is the pass or the cutoff mark. What they do is, for every exam, they take the average score they have a method by which they calculate the average score of that day, and everybody who has scored above that score will pass the exam. The pass rate is around, I think, safe to say, about 70%. And for those of us who have given the Indian examinations, it'll be very easy comparatively, as long as you can manage time. So again, the exam is not very difficult, but your nerves, your time management, and you being present in the exam, that is what matters. There are a lot of resources available for PLAB 1, and any of the resources you pick is good enough. Just pick one resource or add maybe another. So what I used for my PLAB was, I used the Plabbable question bank, and I added it with the Plabbable Gems PDF. So I did not really subscribe to a lot of resources for my PLAB 1. I had all the materials you require are available freely on Telegram, or it's just available. If you know where to look, you will find it. And even for IELTS, I did not use any coaching or any manuals as such. You will find resources on Telegram. You can just use that. Those are way more than enough. And now coming to the PLAB 1, there are no negative marking for this exam. And the exam happens 4 times a year. In India, there are 5 centers. I think Bangalore, Mumbai, Chennai, Hyderabad, and Delhi. I'm not very sure, but there are 5 centers in India, and the exams happen once every 3 months, or yeah, once every 3 months. But the thing about PLAB 1 exam is, getting a slot is your biggest hurdle. The exams you can crack, everything else you can manage, but getting a slot is the biggest hurdle as of now. I think currently the waiting time to get PLAB 1 seats is at least 1 year. So what I would suggest for anybody who is planning the PLAB pathway, give your IELTS as soon as you start your internship, and book your PLAB 1 examination at the earliest that you can. Ideally, I would say 3 months of preparation time is way more than enough, but keep a safe margin. 6 months is definitely enough. If you're in internship and you are expecting like really heavy workload, I think 6 months would be a suitable time. But if you are not in a very busy hospital, or if you can easily have like 4 to 5 hours a day, I think 3 months should definitely be enough. When I gave my PLAB, I was working in a full-time job in a government hospital. So I would get around maybe 4 hours a day. And I, I did my preparation over 3 months. And again, I would suggest internship, because you are fresh with all the knowledge from your final year. So PLAB is not really testing your anatomy, physiology, and things like that. What they test is your applied knowledge. So when you're fresh from final year, you're fresh with surgery, you're fresh with medicine, ortho, I think this is a very good time for you to give exams. And another thing is, what Indians find really challenging, or non-UK graduates find challenging, is the ethics and counseling part in PLAB exams, because these guidelines are very different from what we do in India. So you have to stick to the UK guidelines when you're doing your preparation. There's something called as the NICE guidelines for that. You can just Google it, or there's also something called the Good Medical Practice from the UK that is available on their website. You can download it. Whenever you have any doubts, like say with the dosage of certain drugs or the protocol for particular managements, these are the guidelines you will have to stick to. So next, coming to your PLAB 2 exam. PLAB 2, like I said, the exam is conducted only in the UK, and it is a clinical exam, like it is a practical exam. OSCE stands for Structured Clinical Examination, Objective Structured Clinical Examinations. These exams are conducted only in the UK, and this also is a pass or fail exam. And again, there's nothing like negative marking, or there's no set pass mark for this exam. I think the criteria is you will have 16 stations. 16 clinical stations, and you will have to pass 10 stations, and you will have to make that day's cutoff mark, which is set on the average of that day's performance. So again, there's nothing like the 10 stations is a fixed criteria, but the pass mark varies day to day. I think it is out of 160. I'm not very sure, but usually I think 148 is the mark, and usually the cutoff is somewhere about 104, 110, around that range. Now, PLAB 2, it is conducted 5 days a week throughout the year. There are 2 centers in the UK. They conduct it throughout the week, the 5 days a week throughout the year. I think the only exception being during Christmas and New Year time. For PLAB 2, usually what people do is there are coaching centers, and it becomes very necessary that you take these coaching, because the clinical approach they have in the UK versus in the India is very different. So you will get to know their pathways and their approach only when you have taken some sort of training. There are a lot of academies. I think there is Samson, Aspire, Swamis, and many more. There are a lot of academies. I went to Aspire, and you also have to give a lot of mock exams. So this is an exam. They're not testing your clinical knowledge. In PLAB 2, they're not at all testing your clinical knowledge. What they are testing in PLAB 2 is how you know to manage the patient. Okay, so PLAB 2, they judge each station under 3 criteria. One is your data gathering and history taking. The other is your interpersonal skill. And the third one is your management. So in data gathering and history taking, they're just saying if you know how to ask what you need. So essentially, the scenario will be something like you have a patient coming in, and you will be given a few symptoms that the patient is complaining of, and you have to navigate from there. So you will have to follow a structured approach that they follow in the UK, and excuse me. So and you will have to there are approaches or methods or protocols that they follow for each station, and you will have to follow the same thing. The next is your interpersonal skill, and this is all about how well you can talk to the patient, how receptive you are to your patient, how well you can grasp what the patient is telling, or how well you can it is simply about managing the patient well. And the last one is management here. So one thing I was always told during my PLAB 2 preparation is management is not about giving the right drug or the right treatment to your patient. It is about knowing what to diagnose, knowing what to rule out, and knowing what are the warning signs you need to give your patient. So in PLAB 2, or even when you're practicing as a doctor in the UK, it is absolutely all right if you do not really know the management. You can just say, I will approach my senior, or I will escalate it, or I will just look it up on the websites how to do it. And that is good enough. They don't expect you as a junior doctor to know the management in detail. It definitely helps if you do, and it will definitely increase your score if you have done the management well. But as long as you have done your safety netting, and as long as you have told your patient what to look for, that should be good enough. So management is about that. And like I said, it is conducted 5 days a week throughout the year. So once your PLAB 2 is done, you are anyway in the UK at this point. Clinical attachment is something, it is an option that they give the IMGs to orient to the NHS. It is not, it is an unemployed work, I mean unpaid work. They don't pay us for it. I think some trusts also charge to take us as clinical attachees. And usually the attachment period is around 2 to 6 weeks. So why I would advise people to do the clinical attachment is One thing, it gives you an idea about how the NHS works or how the UK system works. And the more important thing is it helps you expand your networking. So when you are going to the hospital every day, if you're lucky enough and there is a vacancy in the same hospital, um, if you have created a good enough impression on the consultants, you can apply. And a lot of people I know, they get jobs through the clinical attachments. So it increases your chances at getting a job. And like I said, it could either be a paid attachment or an unpaid one. A lot of trusts have started doing clinical attachment programs. So what these programs do is they take about say 12 or 15 clinical attaches every 3 months or so, or 6 months, I'm not very sure. And they recruit, when there is a vacancy, they recruit a doctor from amongst these attaches itself. So you have a very good chance at getting a job if you've done an attachment in such trusts which have these internal recruitment programs. One trust I know which does this is Ashford Peter. I think there are a couple of other trusts also which do it, but I'm not very sure which they are. But even if you're doing jobs in attachments in trusts which are not really running a program, it really helps because like I said, you will know the consultant. And another thing I would advise is, if possible, do more than one attachment but in the same trust. So what this essentially how it can help is, you are ready to work in more than one department. A lot of people in that hospital know you, so the HRs of one multiple people from multiple HRs from the same hospital will have your contact, and they will be able to contact you when there's a vacancy. So becoming an OBGYN specialist in the UK, we will deal in more detail about it later when Dr. Sarita and Dr. Ruchi will talk to you about it. However, to give a brief idea, to enter training, if you're directly entering training, that is without doing the MRCOG, if you're entering the training, what you will require is a signed CREST form if you're entering from India. So CREST is a competency to enter specialty training, a certificate of readiness to enter specialty training. So this form, you can get it signed even from consultants in India who are not registered with the GMC, as long as they have monitored you for 3 months. And you need to have less than 2 years of experience in OBGYN to enter the first level of training. If you have more than 2 years, you are overqualified to enter training at the junior level. So you will have to enter from subsequently higher level, which again has a different pathway. The criteria, once you have the eligibility, there's something called as long listing and MSRA. You will have to make an application. You will have to fill an application. If you if you tick all the criteria of long listing, you will be invited to give something called as an MSRA exam. So this again is a meritocratic examination, and they will be judging your skills in clinical skills as well as your theory knowledge in this. Next, if you have cleared the MSRA, if you have got for MSRA again, there is a now this MSRA is not just a pass and fail exam, it is a meritocratic exam. So depending on your score in the MSRA exam, if you have scored a good score, you will be invited to an interview. So during the interview, there'll be 3 stations. First will be your document verification, where they'll just ask for your passport and some other stuff. Then is something called prioritization task. So in this, they will give you list of 10 things, 10 things that you have to do in a very short time. And they will ask you to choose what you will do first and what you will, like, they will ask you to rank in your order of priority. And then will be your clinical questions. So most of interviews in the UK will have clinical questions as well as ethical questions, because they don't just want good clinicians, they also want good humans and good doctors to deal with their patients. So ethics again plays a major role in your entire career in the UK. And even for your PLAB 2 examination, I think 50% of your stations in your PLAB exam, that is, you have 16, I think you have 14 stations. No, you have 16 stations. So out of that, at least 8 stations will be ethics or counseling. The other 8 will be, one will definitely be a prescription station, and one will definitely be a station where there is a mannequin and you will have to do some procedure, etc. And these are the rest of the stations. But 50% will definitely be ethics or counseling. So that is a very important part of your career in the UK. And in training, so in an OBGYN training, I'm pretty sure you will be taken through this again. So I will just skip through this. It's a 7-year run through program once you enter OBGYN. And you will have to continuously progress. You will have to show that you are maintaining continued professional development. And there are various ways you can do this. I think we will revisit it later on. And you are also allowed to choose a subspecialty of your choice during your training. So now coming back to the whole scenario of PLAB, it comes with its own plus and minuses. So again, PLAB is a very easy exam. Like I said, it is easy for you to crack. And once you start working in the UK, you will have exposure to one of the best healthcare systems in the world. So NHS is a publicly funded service. So the patients don't pay anything at all. So you get to see a lot of, you will have a different exposure than what we are used to here. And another thing about the UK is that it has plenty of opportunities for research. So for people who are into research or are into teaching even, it is a very good option. And I think research is it is a part and parcel of your career in the UK. You will have to conduct research to progress further. And again, you will have excellent work-life balance because it's a developed country. You will have good amount of leaves, a good amount of off, and the pay compensation, etc. And the PLAB exam itself is cost effective. I think my entire expenses, starting from the IELTS to my PLAB 1, PLAB 2, visa, flight, two-way flights, accommodation in the UK, the PLAB 2, academy, stay, clinical attachment, food, everything included came up to 5.5 to 6 lakhs. The entire expenditure of my PLAB exam, including GMC registration and the verification, every cost included was around 6 lakhs. So compared to every other pathway or even NEET fees for that, your NEET coach, not coaching, your NEET PG residency in India, it is comparatively cheaper to all the pathways, be it USMLE, AMC, etc. And in UK, the reason I chose UK over US was that you have a freedom to choose your specialty. In the US, even if you get the first rank in the USMLE exam, there are certain fields that they simply don't give IMGs, like surgical specialties especially. They very, very rarely give surgical specialties to IMGs because for them, they look at it as they see it as them investing on our training, and they prefer to invest on their own residents or their own nationals than foreign students or foreign graduates. But in the UK, it was similar in the UK earlier, but now they have removed those criteria, and now it is we compete at par with the UK graduates. And again, the exams are much easier compared to be it NEET PG or USMLE, etc. Now, coming to the cons, if you have done any research on the PLAB pathway, you would know that job saturation is at an all-time high. That said, people are still getting jobs, and there are still opportunities and options for people to enter training directly, or to enter specialties of their choice. A lot of people do progress, but the job saturation is there. And the waiting time, like right from PLAB 1, the waiting time is very long. So you will need to plan your timeline really smart to make sure you don't lose a lot of years. And there are bottlenecks at every stage. Because this is a problem, because like I said, the NHS is a publicly funded a health system, so they don't charge from patients, so their funds are limited at this point. And when we say it is a free treatment, the clinical liberty or clinical adventure you have is less. For example, you can only, as an NHS doctor, you can only do procedures or treatment protocols that are approved by the NHS. But in the US, you have a lot of opportunity to play around with your clinical decisions, or you are allowed to try out new things and things like that. But in the UK, you have to stick to the guideline. And again, I don't know how practically feasible it is, but the cases you see are limited, because a lot of cases, not a lot, some of the cases do not come under the NHS, what NHS covers. So whatever NHS doesn't cover goes to the private sectors, and those cases you will not see as an NHS doctor. And the weather, for us going from India, the weather is a major setback. It is raining throughout the year. It is, you will hardly get to see the sunlight, but during summers, you have sunlight for around 12-14 hours a day. But during winters, the weather is really bad. And even during summer, it is raining. It's just raining throughout the year. So weather, again, might be a problem for some of us. So now that we've discussed that there is a lot of job saturation, what I would suggest, like I said, plan ahead, start early on. I think an ideal time to start planning your PLAB pathway would be in your final year, or as soon as you start your internship. And during each step of your planning, you have to have buffer time. So ideally speaking, I'm pretty sure all of you will clear PLAB 1 in your first attempt. But for whatever reason, if you fail your PLAB 1, your next available PLAB 1 slot will practically be a year later. Because if you open the slots today, the slots for PLAB 1 are booked till August 2026. So unless there are new slots which open and you are lucky, you will have to wait 1 whole year for your PLAB 1 slot. And for PLAB 2, once you get your PLAB 1 slot, an idealistic, realistic time where you can book your PLAB 2 would be at least 6 months later. So you will have to keep those buffer times in your mind when you're planning. And please start building your CV right during your MBBS. So get involved in research, publish your works, attend conferences. And audits, I don't think is something we regularly do in India, but if your hospital or if your college is encouraging, please do audits as well. And keep a note of all the prizes or distinction. It even maybe small things, it may be even at a college level, or even an interbatch event, but these are the things that will help set your CV apart from the rest of them. A lot of your journey in UK, getting your first job, depends on how well you can present your CV. And please get involved, take leadership, or be involved in teamwork, because in the UK, they're not just looking at your clinical or academic knowledge, they look how well you can function in a team. Because they don't have the concept of doing anything independently. It is all teamwork in the UK. So they want to see a person who will fit a team, not a doctor who knows everything and can do everything on their own. They want somebody who can take a team forward, or lead a team. And the other thing you can do, like I said, is do an attachment or 2 or 3 even, work on courses. So a lot of places, attachment places, they will have seminars or they will have teaching sessions. Whenever you attend these sessions, make a note of that. Keep like a logbook or something, because when you are curating your personal statement, these are the things which you can add on your statement. And definitely connect with your seniors. If you have doctors or seniors who are working in the UK, keep in touch with them, because they can connect you on how to move ahead. The last thing is to stay positive. So you have to keep applying. You will receive a lot of rejection emails. You will receive a lot of unfortunately we are not processing your application further, but that is part of the process. So you just have to manifest, and you have to know that it'll take time, but you will get there. So yeah, that is about the PLAB pathway for UK. If we have any questions. Yeah, I hope that was uh, what you were expecting from the session. Yeah. Okay. Okay. Nivedita is asking if we will be able to apply for a date before we finish our final year. No, you will need your primary medical qualification to give book your PLAB 1 seat. So you can definitely create a GMC online portal even when you're in say second or third year. But you cannot book a PLAB 1 seat unless you have your PMQ, your primary medical qualification. So as soon as you get your final year results, I think then you can book. Even if you don't have your degree as such by then, once you have your final exam results out, I think you will be allowed to book. But before you finish, before you are officially qualified, I don't think you can. Cert certification, I think that is, I think, Shay, I think you mean the PG cert, right? So I am not very sure about that. I think it is once you have done a diploma or a PG degree, it is then that you apply through the cert pathway. Not very sure on that. How many months is required for IELTS? IELTS, okay, personally, okay, Shrey, you meant CREST. Okay, I'll come back to that one. Yeah, so CREST is readiness to enter specialty training. So what happens is, if you want to enter PG training, the residency pathway in the UK, you will have to prove to them that you are qualified, or you have the equivalent experience as their first year trainee would do. So in the UK, they do 2 years of internship. They have foundation year 1 and foundation year 2. But in India, we have only 1 year. So you will have to either work an additional year in India, or you can do an FY2 standalone in the UK. So at the end of their FY2 program, their students get something called as an APCC certificate, which says that they are ready to enter training now. But for us, since that's not possible, what we usually do is, if you're directly applying from here, you can work in any hospital in India or under any consultant in India, and you will have to get a form signed from them. So it has a certain checklist, like do you know to manage patients, do you know to take data, do you know certain simple procedures like venipuncture, phlebotomy, etc. Are you proficient in that, and has the consultant supervised you? So if you have ticked all of that, if your consultant has signed off all of that, then you can directly apply to enter training. Another option, what most of us do, is that we will work an year in the UK, a non-training job. So this post won't be recognized for training. It is just like how we work in India, right? After MBBS. So you can work there as well in a non-training post, and there you can get your form signed there. But now, given that non-training jobs are getting saturated, what people are preferring to do is get their crest signed here in India and directly enter for training. So if you are interested, say like psychiatry or GP or IMT, etc., these branches are comparatively easier to get into. So especially for psychiatry and GP, you just need a good MSRA score. And I think most of us can get a good MSRA score if we put in 3 to 4 months of preparation. So once you get your crest signed, you can directly enter psychiatry or GP training. So that is one advantage or one way you can look at entering the UK directly without going for a non-training job. So crest basically is that form which your consultant will have to sign. So I think you will just have to have worked for a minimum of 3 months in under that consultant. Yeah, Nivedita, no, you don't have to work 1 year. 3 months is enough. Your consultant has to sign off saying he has overlooked you for um, at least 3 months, from this date to this date, for a period of 3 months, and you have met all those criteria. So that is good enough. I hope, Shrey, that is clear. Yeah, for IELTS, how many months preparation is required? If you have done your schooling and everything from an English medium school, and if you're quite confident in your English, I think 1 week is also enough for IELTS. But just to keep a safe timeline, I would say give it 2 weeks if you're confident in your English. But I think to be very fair to everybody, I would say just keep 1 month of time. And sources I use. So the moment you sign up for your IELTS exam, you will get something called, you will get a book, the IELTS academic book. So these books are also, the soft copies are available on Telegram. You just go and search academic IELTS Cambridge. You will get like a lot of these books. I think the current version is 20 or something. Start solving these questions. Each book has uh, four test papers, mock papers. Time yourself and just give the mock exam. See how well you're scoring. I think since you require 7 in each domain and 7.5 overall, um, these exams are very similar to the actual IELTS exam. So you can definitely predict your score depending on how well you're doing in this exam. But the setback for this is you will just have you can only assess your listening and reading, because speaking and writing will be subjective. It will depend on your examiner. However, I think if you have a good enough reading, I think you can, for listening or speaking, you can just write something and send a senior who has already given IELTS. And I think that should be good enough. And if you are very unsure, there are a few websites and few organizations that will evaluate your IELTS speaking as well as writing. But again, these are charged services, so you can take those. But the resources I used were just the IELTS materials. I think I solved around 3 books, so that is 12 papers in total. I think you will be good to go once you have done that. The thing about IELTS is you need to know what they expect from your answers. Listening and reading is straightforward, but for speaking and writing, you need to know what the examiner is expecting. Like in speaking, they're not looking at how good your content is or how good what you are saying. They're just looking at if you have that language fluency. They just want to make sure your English as a language is good. They're not really looking at the material that you're telling. They'll give you a topic and ask you to talk. They don't see if the content you're telling is right or wrong. They're just seeing if you have a fluency and if you have that continuity of thought. For writing as well, they are looking at how well you can place your opinions or how well you can summarize an image that they have given you. And what they are looking for in writing is if you can use complex sentences as well as simple sentences, if you have a steady flow of thought, if you can structure your answer well. So these are the things they're looking for in your IELTS. Basically, they're not looking at anything content oriented. So IELTS should be easy as long as you have studied in an English school or if you have been talking in English for quite some time. My JR department taken into consideration. Non-academic. Yeah, non-academic JR will be taken into consideration. Surgical experience will be necessary for you to enter surgical training. It's always good to have experience in the department or in the field you are applying for, but it is not mandatory. Whatever you have done in India will definitely be considered. They will, it is valid and they will consider it. Again, it depends on how well you can describe your duties or how well you can portray the things that you have done. It is not just about what you have done, it is about how well you are presenting it to them as well. And again, it's not very mandatory to have experience in that, but it's good if you have experience. So it all comes down to the fact that in an interview, if they have two candidates who have done equally well, that is when they will look at how much experience you have. That will be a choosing factor if it comes down to that point. Otherwise, they will just look at all clinical experience as clinical experience. They will not look at the particular field. But again, now given the competition that is rising, it definitely helps to streamline your department of choice right from the beginning. It will be definitely helpful if soon after internship itself, if you choose a job of in that same field. So it'll help, but it is not mandatory again. Do we need 2 years worth experience exclusively in OBGYN? No, you don't need 2 years exclusive in OBG. I think you're asking to enter training directly, right, Nausheen? So you won't need 2 years is the upper limit. Okay, even if you have just 6 months in OBGYN, it is good enough for you to enter. The thing is, they don't have something called underqualified for a clinical experience, but they do have something called as overqualified. So if you have more than 2 years clinical experience, you will be overqualified to enter specialty training 1. So then you will have to enter specialty training 3. That is, you will have, I'm not very sure how that pathway works, but you will have to apply to specialty training 3 if you have more than 2 years of experience. Less than 2 years is absolutely fine. You don't have to have exclusive OBGYN. Rotating internship in all departments is absolutely fine. They don't really need specifically that experience. How long will the PG course be in UK after passing PLAB? Okay, Dia, this depends on what which specialty you choose, as well as how committed you are clinically. So for GP, it is just, I think, 3 years until you become until you finish it, and most of the others are 6 to 8. If you're asking OBGYN in particular, it'll be 7 years, your PG training. But the catch is OBGYN is a run through program. So you will enter ST1 and then for 7 years you will be in OBG as long as you finish your exam. So I think you have to finish MRCOG part 1 before you can enter ST3 level. So if you have done that, you can enter ST3. But if you have not finished your MRCOG part 1, you will be withheld. So you cannot progress to ST3 until and unless you complete your MRCOG part 1. So it depends on you. If you have finished, you will if you have finished everything according to the timeline or the standards UK has set, you will finish in 7 years. But if you take your own time, you will take longer. And another thing is, you can definitely take breaks during your training. You will just enter back. So I've seen a lot of people who enter training, but they take a year off for maybe marriage or childbirth or to look after the child. They will come back and continue from where they left off. So that's not going to be an issue. So it depends on you, on how well you are. But I think realistically 6 to 8 years would be an ideal time to finish your residency in the UK. Internship plus crest in India will give you direct entry to core training. Karuna, you cannot get your crest signed just after internship. You will have to have worked at least for some time to get your crest signed. So 3 months is what they say. Again, to get into core training, your crest is good enough, but in your interview, they will look at your experience. They will look at how much experience you have. That can again be a deciding factor. But internship, you can't get your crest signed. Once you're done with internship, if you have worked for 3 to 6 months and you have your crest signed, that I won't say it will give you a direct entry to core training, but you can apply to core training. Whether you get in or not, again, will depend on various other factors. But yeah, you can try to enter. Explain what the MSRA exam is. Okay, so MSRA is basically they are testing how ready you are at par with a UK graduate who has finished their FY2 exam. So again, this exam as such is not difficult at all. It will test your basic knowledge in medicine, surgery, etc., in various other specialties. And they will also be testing, they have something called as an SJT, situational judgment test. So they will give you certain scenarios and they will ask you what you will do in this scenario. So this is something that Indians will need to practice a lot, because again, UK protocols, their procedures, etc. But yeah, the MSRA is I'm not sure, multiple specialty entrance exam, something like that. So again, they will be testing your clinical knowledge as well as your judgmental presence, clinical presence. And this is a meritocratic examination. That is, it depends. You have to get a good score to get called to an interview. And every field or every specialty has a different cutoff score. So I think for GP it'll be one score, for surgical training it'll be another score. For GP and psychiatry, just based, if you have done well in your MSRA, you will directly be allowed to enter training. But for surgery, IMT, and even OBGYN, depending on the score of your MSRA, you will be invited to give an interview. If you have done well, you will be invited for an interview. Depending on the interview scores, then they will give you ranks again, based on which you will be choosing your training. And when is it supposed to be given? I think the opening is once in November and once in Jan and Feb. During that time, the applications are in August and in around December. It keeps changing, but around this time is when you apply for MSRA. Can you please explain difference among all job posts? I think we are already running late and we're short of time. But junior clinical fellow, junior teaching fellow, so these are basically different. They basically are how your job will be split. Okay, so if you're doing a junior clinical fellow, it is a grade. It is a grade at which a junior doctor can enter. All the FY2, FY3, FY1. These are all levels you can enter without much training. But junior clinical fellow, your role will mainly be in the clinics. But if you're a junior teaching fellow, your duties will be split. You will have to do 50% clinics and 50% teaching. So that again will depend on your trust. And ST, CT, these are all just different levels at which you can enter. CT is core trainee, ST specialty trainee. FY3 again is after 2 years, you will be eligible. So these are different levels. I think we can have a different session on it some other day. I have given MSRA in Jan. If I come in category of interview for OBGYN, so clinical prioritization station, they'll give you around 10 tasks, okay, and they will tell you to prioritize your tasks based on what you will do first and what you will do last. I think usually they will just discuss the what you will do first 3, what you will do last 3, and why. So the rationale simply has to be that you will prioritize patients first and then you will do the non-clinical work later. The emergency will come first, things like that. What you would do as a doctor, even in India, when you have a lot of, it's basically when you have a lot of tasks at hand, how you'll prioritize, whether you know to prioritize your patients or not, or your work or not. That's about prioritizing. Can you elaborate on study materials for MRCOG? I think Akanksha that will discuss in the next session about MRCOG in detail. But the study materials, as far as I know, would be your standard textbooks itself. But there are websites and other apps also which you can use. I think for surgery, I know there is EMRCS, and for medicine, there is Fast Medicine. MRCOG, I'm not very sure what it is, but I think maybe Dr. Ruchi or Dr. Sarita will be able to throw some more light on that. Talk about the over eligibility criteria. No, internship won't be counted for to become overqualified. Internship is part of your education, so internship is not counted. Only any jobs you take up after your internship, that will be counted for overqualification. The names of books for interview. I think interview books are there's just interview preparation for books available. Again, these sources are also available on Telegram. They're available on all the WhatsApp groups that you can do. Yeah, medical interviews book is there. So these books you can use. Yeah, I think we can wrap up the lab session. We do have an MRCOG question session coming up, and I think most of your MRCOG questions will be taken up then. Thank you. No, Shri. So PLAB you can give at any stage. Even if you have done your PG exam, you can give PLAB. Even if you have 10 years of experience, you can still give PLAB. But if the more experience you have, the better options at job you have if you give the MRC exams. So MRC exam is PG qualification in the UK. So if you have given your MRC exams, there are better chances for you to get non-training jobs, and even to enter training, that'll be a better option. But there's no restriction for PLAB. PLAB exam you can give at any point, even with 10 years of experience if you choose. When I went to give my PLAB exam, there was an OFTAL associate professor from India who was giving her PLAB exam. She didn't want to sit the MRC off. MRC off is comparatively much tougher. So she wanted to get her registration through the PLAB pathway and then work around the MRC off later on. So there's no overqualification for PLAB exam. You can give it at any point. The overqualification comes in only for training. Yeah. So I think we'll wrap up PLAB now. Thank you.
Thank you very much, ma'am. So we'll start with the second half. Before that, we'll have a quick introduction. So now we have Dr. Ruchi and Dr. Sarita, ma'am, who will be talking about MRCOG. And before we begin with the session, I would like to give you all a brief introduction about them. Dr. Ruchi is a consultant obstetrician and gynecologist with multiple degrees, including MRCOG and BSCCP, and with a vast work experience, as she is currently working at Breach Candy Hospital and the Apollo Spectra in Mumbai. Her special interests are in colposcopy, maternal medicine, high-risk pregnancies, minimally invasive gynecology. And lastly, we have Dr. Sarita Bhalerao, who is also a consultant obstetrician and gynecologist with multiple degrees, and was also the past president of the Mumbai Obstetrics and Gynaecology Society. And ma'am, you can begin with the session now.
So, good evening, everyone, and thank you for joining us this evening. I'm Ruchi, and just to give you a little bit of a background, I have worked in the NHS for the last 8 years, and I've just recently returned to Bombay. And my talk today is going to be more for the students who are actually practicing OBGY or are in postgraduate training, or who are aspiring to go into OBGY training. So I have no disclosures, and I'm going to talk a little bit about the healthcare system in the UK, the body that governs the Obstetric and Gynaecology Society, which is the Royal College of Obstetricians and Gynecologists, and the exam which we need to give, which is the MRCOG. So understanding the differences, we just need to understand the concept of the National Health Service or the NHS, the difference in the health structure, and the difference in training. So this is just a simplified comparison. The governing college in India is the ICOG for obstetricians and gynecologists, whereas in the UK it's RCOG. The medical council is MCI, or we have the state medical councils, we have the GMC for all of UK, and the basic healthcare unit, what we call a hospital in India. The UK just has a different term for it, and they call it a trust. The approach to healthcare is also a bit different between India and UK. So India has more of a paternalistic pattern of care, but this I've definitely seen changing over the last decade. So it is not just that we tell as a doctor, we make the decision and the patient should comply. It's a shared decision making, and that the whole trend has definitely shifted in India as well. Whereas in UK, it is definitely a shared decision making. The doctors offer options and the patients make their own choice. The medical structure is also different. So the India medical structure, as we all know, if you are an OBGYN resident doing your post-graduation in obstetrics and gynecology, we have a large number of patients, but we also have a very strong on-floor team. So you will have your head of unit, you will have an associate professor, you will have a lecturer, and you will have varying degrees of residence depending on which year of postgraduate training they are in. And you will have your interns and medical students as well. However, the patient-doctor ratio is very high, and the entire medical team shoulders all the patients. The National Health Service, which is a publicly funded health service that runs throughout the UK, is basically every person in the UK pays tax, and some amount of the tax goes into the National Health Service. So in the end, the patient going into a hospital doesn't have to pay any money, whether it is for a simple cesarean section or whether it is for a cancer surgery. It is free of cost. The medical structure in the NHS, there are lower number of patients if you have a comparison with India. India has the highest population in the world, so we will have the maximum number of patients. However, the on-floor medical team is quite small compared to what you would be used to working here. The on-floor medical team will have one consultant, one senior registrar, one SHO, and probably an intern. So the patient-doctor ratio is even higher. However, if you're only practicing obstetrics and gynecology, we have midwives. So NHS has midwives. They are equivalent to your first year residents or first year trainees, and they're very well trained to perform everything normal deliveries, episiotomy, suturings, antenatal care for low risk patients. So they will take the bulk of your work away, and as a doctor you would only see the complicated patients. So with the midwife support, the medical team, which is us, sees only the high risk patients and an acutely ill patients. So even fewer doctors can manage the higher number of patients in the NHS. So is it all rosy? Of course not. There are very important issues to be addressed if somebody is thinking about going to the UK to practice. The biggest thing is medico-legal litigation. So if you just compare the 2013-2014 data, in India, about 97 doctors in the last 3 years, this is the 2013 data, that is, they had implications from medico-legal litigation. So there were about 97 doctors published, which makes it about 5.67 doctors per 1 lakh doctors. However, in the UK, they only had about 1.78 lakh doctors, but 157 doctors had to face medico-legal litigation. So that makes it 88 doctors per 1 lakh doctors. So the ratio from 5.67 to 88 doctors per 1 lakh doctors is really high. And the highest medico-legal litigation in the UK is in the maternity sector. So there are important issues because when you work in the UK, you're not only judged on your professional life, but like Dr. Ninada was explaining, it's a reflection of the society's expectation of the profession. So if you do have a case, you are judged on various issues about how honest you were, whether you did drinking and driving, whether you have any other clinical issues, whether you had any inappropriate relationships. So you need to be an overall honest, ethical professional. which is why the standard of care expected is very high, and a sizable portion of it will fall on the registrar on floor. And the registrar is equivalent to a lecturer level in India, I would say. You should have very good knowledge, good decision making, good operative skills, good communication, good empathy, team management, and ability to handle pressure. You need multiple qualities. All of these qualities are, of course, very essential to be a good doctor as well. And despite being omnipotent, in the UK, you can always ask for help. Likewise, in India, you can also ask for help. But in India, if you go into private practice, you need to form your own team. Whereas in the UK, there is already a team. There are so many qualities required that it almost looks like an unreasonable matrimonial ad. And that's where the MRCOG comes in. The MRCOG outlines roughly the standards of care expected. And more than being an exam, it is a process that expects you to be the best version of yourself as a clinician. It is the gold standard of exams in obstetrics and gynecology. So I'll briefly talk about how many parts are there to MRCOG. MRCOG has 3 parts, part 1, part 2, and part 3. And MRCOG is equivalent to our MS or DNB, but it is a exam which is a lot tougher than our postgraduate exams. So let's briefly talk about the part 1. Part 1 is basically your basic and applied sciences. The first step to taking the part 1 is the prerequisites. Anyone who has an MBBS degree can actually give MRCOG part 1 because it's testing your basic sciences. You will need to have a little bit of knowledge about all the subjects that you learned in MBBS. The prerequisite is you create an RCOG account, you get your MBBS degree notarized, and you should have an MCI or a state medical registration. Then you have an eligibility form for part 1, which is easily available on the RCOG or the Royal College website. And once your eligibility form is accepted, you need to give an expression of interest form to take the exam. It's a computer-based exam, and after COVID, there are lots of test centers all over India to take this exam. It is held twice a year in January and July. The cost is approximately 70,000 just to take the part 1. Once you've taken the part 1, you are now eligible for the part 2. And basically, part 2 is the UK medical system, their demographics, the problems faced by the clinicians in the UK. It is a very UK-based exam as it tests your knowledge mainly about the standards and guidelines of UK. Again, it's a computer-based exam. However, the part 2 has 2 papers. Paper 1 tests obstetrics. Paper 2 tests gynecology. And the format of these papers is by extended matching questions and single best answers. Prerequisites are, if you've passed the part 1, you can take the part 2 exam within the next 7 years. There is also a terminology about how long something called as exam currency and the number of attempts that you can take. And for each part, it is a bit different. And again, this information is available on their website. The cost is again the same as part 1. So approximately another 70,000 to take the part 2. And the part 3 is the boss level, where you have now mastered your theory and you're very good with your knowledge. So the part 3 then tests your clinical skills in obstetrics and gynecology. It basically consists of 14 stations. It's a practical exam, more like a Viva that we give in India. The part 3 is 14 tasks in a circuit. And now in this exam, they're not really testing your knowledge. They are going to test you at how good a doctor you are. So they see whether you are safe. They look at the patient safety aspects. They will see how you're communicating with your patients and their relatives. Your communication with your own colleagues, whether you are referring them to a different specialty or whether it is communicating with the GP. How you are gathering information from the patient, which basically focuses on history taking, and the applied clinical knowledge, which is the management and treatment of the disease that you are seeing. The good bit is, initially this exam was only taking place in the UK, but from the last 5 years, 2018 being the first, They started conducting this exam in India, and Mumbai, Kolkata, Delhi, and Chennai are the 4 centers. The cost of giving the part 3 is slightly higher than the part 1 and part 2. It's approximately 88,000 rupees. What do you get after MRCOG? The MRCOG qualification is the gold standard. It will get you a GMC registration, but it can also become your ticket to the UK. You can go to UK. You can work as an obstetrician and gynecologist in the UK. So just to give you a little bit of a difference about at what stage of training you take the MRCOG exam, the Indian post-graduation system, so you do MBBS for 5 years and then you do an internship for a year, and then you take up post-graduation in any of your fields, and that is basically 3 years. Whether it is surgery, whether it is medicine, whether it is obstetrics and gynecology or dermatology. However, in the UK, the internship is 2 years, like Dr. Ninada was explaining. The internship is called foundation training in the UK, and there are 2 years to it, FY1 and FY2. Following which, people then apply for applications and they undergo interview processes to get into their specialities. Obs and Gynae is a run-through training, which means that if you get into the first year of Obs and Gynae, you will remain in Obs and Gynae up to the 7th year. There is no repeat interview to continue your training. However, you need to give the MRCOG parts, part 1, part 2, and part 3 during your training. Part 1, you need to give before ST3. Part 2 and part 3, you need to give before ST5. ST1 is just first year of training. ST means specialty training. So ST1 is first year of specialty training. ST2 is second year of specialty training. So part 1 needs to be given before your 3rd year of specialty training. Part 2 and part 3 needs to be given before the 5th year. If you clear the part 3, then you are eligible for the advanced training years of ST6 and ST7, where you can then sub-specialize directly either in gynae oncology or reproductive medicine or sub-fertility, or you can do purely obstetrics and no gynecology. So ST5 is actually the level which they consider, if you have to do an equivalent of that, it is post-MD or MS OBGY in India. The real value of the UK experience, if you've already completed your post-graduation in India, the real value is at the ST6, ST7 level, where you can then sub-specialize and gain advanced training in the field that you want. So these are just comparison of the terms that you're familiar with. Internship is foundation year. Intern is a foundation doctor. Post-graduation training is called specialty training. A resident is a specialty trainee. However, the UK has just moved that term to call a resident doctor. So they are now the same terms in UK and India. Houseman is called a SHO. That means SHO is ST1 and ST2. From ST3, you become a registrar in India. Registrar in UK. So of course, clinicians who practice in India also learn the same. However, the training in UK is a bit more structured. It is 7 years, it's a longer training, and it also permits training into doing fetal medicine, ultrasonographies, fetoscopies, in utero surgeries, which is the advantage of training in the UK. The other aspects of growth are, because I said the training is very, very structured, this is the kind of portfolio you maintain. So this portfolio is an online portfolio which the Royal College gives you when you enter training, and it assesses you in these 14 modules. Something similar to a logbook of India. However, in our logbooks, we only maintain the number of procedures we are performing. These 14 modules are going to test you overall as a clinician, your leadership skills, your team management skills, your research skills, whether you are doing any quality improvement projects. How are you as a teacher or an educator? Are you teaching your juniors? It of course tests you on all of your clinical aspects as well, which is emergency obstetrics, non-emergency gynecology, non-emergency obstetrics. But it assesses you as an overall professional rather than just being able to provide treatment for the diseases. So the simplified journey is, if you're already in Obs and Gynae, you can appear for the MRCOG. Just like the PLAB, you will also need to give your IELTS or OAT, which is the English language qualification, following which you get your GMC registration and you begin as a doctor in the UK. And where do you go from there? So after you worked in the UK, you can continue after you finished your training, you become a consultant in the UK, you then stay in the UK, you get more training and continue to work in the NHS. Or you have the option of returning to India when you feel you have achieved what you wanted to gain from the UK, and that is what you moved for. So wherever you like, the world is your oyster. MRCOG is valid in many, many countries. It also opens doors for you in Australia, in Southeast Asia, and obviously in India, it's a recognized degree. What you will definitely achieve is a deeper dive into the knowledge of obstetrics and gynecology. You feel more confident about the subject. You also get some soft skills. Sometimes when we are working in a government setup, you are seeing 100 antenatal patients a day. You don't really have the time to talk to your patients. All you have the time is to give a prescription, write some investigations, and see them in the next outpatient clinic. Whereas here, there are some soft skills. Every patient you see will get 20 to 25 minutes of your time. It's more like private practice in India. Exposure to new thoughts. Also, you get a decent pay because £1 is equivalent to 107 rupees in India. So it's a decent pay, but it is only if you convert it. Living in the UK is expensive. And the most important thing, you will get lots of Instagram photos, which you can put when you have your college degree, when you have your MRCOG, when you attend international conferences, and you get to meet lots of people from the Royal College itself. Some of these photos are my team, and a lot of them are midwives who I work with. Like I said, there is a higher ratio of midwives, and you will probably have just 1 or 2 doctors working on the floor. Thank you very much for your patient listening. And I really want to thank Sarita ma'am, who is my mentor. Everybody needs a mentor, and I wish everybody gets a mentor like her. She has guided me a lot in my journey. I've been practicing OBGYN for the last 15 years, and she has guided me to do MRCOG, to go to UK to work, and it has made me a better professional doctor today. Thank you. I'm happy to answer any questions if anyone has any questions.
Yeah, I think, Ruchi, that was a wonderful presentation, and I've been listening all evening, even to Ninada's presentation. And I think it's really been quite a learning experience, even for me. So I do hope that all of you have enjoyed the session. And we are happy to answer any questions. I don't know if I'll be of any help because now it's been many years since I did MRCOG, but we can always try. Okay, so I think you can take that.
Yeah, I can answer that for you. Hi, Akanksha. So for MRCOG Part 1, there are various basic books available. However, there are lots of online courses as well, which you can do. The RCOG website itself has a RCOG e-learning on MRCOG Part 1. And it's basically just trying to practice the kind of questions they ask in the exam. There are lots of telegrams groups as well, which give you like the recalls, which they have asked in the previous exams. There is a specific book. I cannot remember the name from top of my head, but I'm happy to share it with Ninada, and she can share it with you on LinkedIn for the Part 1 exam.
I also thought I'll come in at this point and tell you that the India Representative Committee of the RCOG is very active. And we do have courses in India, both private also. There are Delhi, Hyderabad, Chennai, many courses for the Part 1 as well as for the Part 3. And we are now looking at an RCOG franchise course for the Part 3 as well. So all these things are available in India. I think somebody asked just now, what is the right time to do the MRCOG? And I really think that this is very important because it's not an exam that you just study and pass, as Ruchi said. The more senior you are and the more experience you have, you have a much better chance of passing. And people who've done their basic training in India and then have worked in the UK for some time, passing becomes very simple for them. Even people who worked in India and have worked at a little senior level, at lecturer level, or as, even in private practice, they have a better chance of passing. So don't be in a hurry to pass that exam. Requires some level of maturity which you only get, I think, after 3 plus 2, at least 5 years of experience. So I have been an examiner now for the MRCOG for many years, and we do find that people who are more experienced pass easily. So I think that is the main thing. What was the question she asked? I didn't see it.
It says MRCOG is really difficult. A lot of them say it's difficult, especially part two. If we give MRCOG and then want to settle in the UK, is it really worth it?
So here again, I don't think it's difficult if you take the right steps and if you plan in time and you're not in a hurry and you get the necessary experience, then you will pass it. I don't think it's such a problem to pass. Whether it is worth it or not, that's a decision one has to decide for themselves, and that you have to decide what you really want. And everything is worth it. According to me, whether you settle here or you settle there or whatever, it's all worth it. Even if you do MRCOG and come back, it's not a waste. If you decide to do it and stay on there, well, that's also fine.
Absolutely, I would completely agree to that. The next question is just the competition and saturation is so much, most candidates are giving it just to secure a job. Well, that is basically it just depends whether you want to work in the UK or whether you want to remain in India. However, even if you don't want to work in the UK, MRCOG is an exam which is going to improve your knowledge, improve your confidence, and improve your management plans for your patients. So I think it is still an exam worth giving.
Don't think of it in terms of getting any returns directly. Don't think that because you get MRCOG, you will earn more or you will get more patients. I don't think that's the way you should think of it. If you enjoy the subject, just do it for the love of the subject and do it for the learning and reading and, your own betterment, nothing else.
Just to add a little bit something. I mean, of course, you both of you know much better, but just to add to what Akanksha is saying, the competition and saturation is higher. But I think one thing we don't understand as IMGs going from India is, like ma'am has already said, the fields are much different in India and in the UK. Just because you like OBG as a subject or a branch here is not an assurity that you will like how it is being practiced there. So I think it's a very strange bet to take your MRCOG right at the start of your career. I think, like Dr. Sarita already said, I think once you have an experience in UK how gynecology or obstetrics works, I think when you have that experience, that will be a better stage to sit these exams. Unless you're absolutely sure you want to do OBGYN, I don't think giving the MRCOG exam at the start of your career would be very wise. But again, then your independent take on it would also matter to it.
There's another question. Is MRCOG valid in Dubai as well? We have heard Dubai gives better opportunities. MRCOG is valid there. And it would depend if you want to settle in Dubai. But the pay and the kind of job that you get will depend on what kind of work experience you have in UK. The pay scales change and the kind of job opportunities change depending on the kind of time you've spent in UK. I think we don't have any more questions.
Ma'am,
Somebody
I
else.
think we missed a question. If a student wants to be a gynecologist, what would you suggest? The PLAB route or the MRCOG route, which is better?
Should I take that question? So,
Yes.
either of the route is fine. There is no right or wrong. If you don't want to do the postgraduate training in India, you can do the PLAB, get your GMC registration, and apply for a job in the UK. You can then be eligible for the ST1 run through training program. If you're already in OBGY training, then you can still go to UK through the MTI route and then apply for the ST3 interview training. So you will join that training program at the ST3 level instead of ST1 level, which gives you a bit of an advantage because you're already have gained the experience that you need from India by doing your MS or your DNB.
I think if you want to practice in India, essentially, then it may be better to do an MS here first. Simply because you will be better prepared for practice in India. That's the only reason. It's not that you can't come back, but it is better if you do the basic degree MS from here.
I think there's another question saying, are the opportunities full in the UK? Because we complete part 3, we need to compete for ST6 job. Obs and Gynae is a run-through training, so you don't need to compete for the ST6 job. Once you have finished your part 3, you directly enter ST6, ST7, and then you can choose your subspecialty you want to train it. You will anyways complete ST6, ST7, but if you want to subspecialize only in subfertility or only in gynae oncology, then you need to apply for that particular job at ST6. But it's not a mandatory thing that you need to do. Once you enter ST1 or ST3, it's a run-through program as long as you finish your MRCOG exams. I think that's the end of the questions in the chat box.
There is, I think, one last question. Ma'am, could you throw some light on clinical attachment or other requirements?
Ninada, would you like to take that question?
Yeah, ma'am. Sure. Thank you. So Anusha, I think clinical attachments can help you get a job. It depends on uh, it doesn't have to be in OBGYN. They don't see if you have clinical attachment in the particular field, because honestly, in clinical attachment, you won't really have a license then. So you won't be doing anything as such. The only thing you will get out of an attachment is that you know the NHS protocols. And these protocols will be similar irrespective of which field you have done an attachment is in. So as long as you've done one attachment, I think it's good to go. The only place where you have an advantage in doing clinical attachment is if you have already done an attachment in the same hospital and that hospital has a vacancy, then they will call you back. So that is an advantage you can have. But otherwise, it doesn't matter, because I personally have seen people do attachment in an entirely different branch and get a job in an entirely different field. So as long as you've done like 1 or 2 attachments, but again, it'll help to show your commitment to the field. But clinical attachment is neither considered clinical experience nor it is considered an employment. So it is not really adding to your CV or your clinical experience, but it is just something you can say that you know about. So it is not a requirement as such, but if you've done it, it is good. Welcome.
So I think that's the end of the session. Thank you very much, Dr. Ninada, Dr. Ruchi, and Dr. Sarita, ma'am, for taking out time for us on a Sunday and delivering such an amazing session. We truly got a detailed insight about the overall OBGYN pathway in the UK. And thank you very much everyone for joining and making this an interactive session. And I hope all your doubts have been cleared.
Thank you. Thank you for
Thank
having
you.
us. Yeah, it was
Thank
a
you so much.
pleasure. Yeah. Bye-bye.
Bye. Thank you.
Thank you, ma'am.
Bye. Have a nice Sunday.
You
Bye.
too. Bye bye.